All right, we're going live.
Each year, the Arizona Alliance of Community Health Centers selects one community health worker from across the state who's made a positive impact on health center operations, health center patients, and the community, and who has exceeded patient expectations as our invaluable community health worker of the year. I'm honored today to share that our 2021 invaluable CHW awardee is Leslie Todd from North Country Healthcare. Leslie, your nominator shared letters from your clients who spoke about you, about how you've been a lifeline and a hero to them throughout COVID. Your constant communication and personal visits with clients truly made a difference during this time. Thank you for your commitment, your compassion, your ability to always follow through. It's a privilege to present you with this award.
Thank you, Dr. Elk. It's an honor to receive this award. It's a huge achievement, and it shows that my visits and everything I do is helping. I might not be able to help everybody, but the ones that I can help, it makes a difference.
Well, congratulations. You certainly deserve the award.
Thank you.
Hi, I'm CJ Hansen, CEO of Canyonlands Healthcare and board chair of the Arizona Alliance for Community Health Centers. I'm honored to be the first to welcome you to the 2021 AACHC CVN Annual Conference. Canyonlands Healthcare is a rural community health center with sites in many parts of the state. In traveling to our sites, I've seen the impact of COVID-19 statewide. I'm proud of what each Arizona Community Health Center has been able to accomplish over the last 14 months. The COVID-19 pandemic is among the greatest challenges we have faced in the history of the Community Health Center program. We have been challenged to reorganize staff, change our care delivery model, rapidly expand telehealth, and become testing and now vaccination sites for our patients and our communities. We've faced many challenges, but through teamwork, commitment to our mission, and innovation, we have persevered. We continue to be one of the first lines of defense, no matter the situation. This is why the Community Health Center program continues to be trusted by the state of Arizona and the federal government. We know our community's needs and take an active role in resolving problems. I'd like to congratulate each Arizona Community Health Center for its dedicated and ongoing work during the pandemic. I know one of the reasons we all typically look forward to the annual conference is because it allows us an opportunity to network with our peers face-to-face. Unfortunately, we aren't able to do that this year. But with this agenda the Alliance staff has put together, I'm confident we will walk away feeling invigorated and ready to take on the next opportunities that await us. Again, welcome to the annual conference. I'm looking forward to spending the next 4 days with you.
We've seen our community partners struggling to just manage regular operational issues because of unforeseen costs specifically related to COVID. And we've also seen our nonprofit partners who serve the community see their needs and the needs of their community double and triple, and they just weren't prepared for that. So that's what these grants are designed to address, those unforeseen costs and increased needs. It's kind of a lifeline, a temporary support to just make sure that these organizations make it through.
Aside from a doctor's office, we are the only source of COVID-19 testing in this community. So our role, again, is not just as a hospital, but as an advocate to protect the community and community health.
There was lots of hoorays and
A few
we were all-
tears.
a few tears.
Everyone was ecstatic. It's something that has never happened to this facility before. You just don't know what it means.
The response was, a lot of times we are forgotten. That was a message that resonated with me so much because they're not the only ones. We have a lot of areas in our state, a lot of communities, a lot of populations who right now feel forgotten.
The monies that are provided through this grant have made it possible to help the families we serve get the help that they need during this difficult time. Arizona Complete Health clearly recognizes the role of peer and family-run agencies in providing and enhancing access to quality integrated health services. Recognizes the challenges, the extra challenges that are created by COVID-19.
Having this extra money from Arizona Complete Health is going to make a huge difference to just get us through this first wave and allow us to save and kind of revamp and make sure we can become a sustainable business again.
Our job as a healthcare organization that's focused on human care is to be that voice, to be that support to people who feel they are not valued.
Thank you. All right, good morning, everyone, and welcome to the first official day of the AACHC and CVN 2021 Annual Conference. My name is Janelle Peterson. I'm the Director of Communications and Training here at the Alliance, and we are so excited to kick things off today with a COVID-19 panel session. I want to thank our session sponsor again, I2I Population Health. In this session today, we're going to talk about the role health centers have played in the COVID-19 response, how COVID-19 has impacted the Navajo Nation, and how Navajo leaders have worked to protect tribal members. And we're going to hear from the state on how they have led COVID-19 response efforts and how health centers can continue strengthening their partnership with the state to achieve success. And then key lessons learned and opportunities going forward. There are several ways you can engage in the session today. You can use the chat feature, the Q&A feature, or you can raise your hand and we can unmute you once we get to Q&A. Otherwise, all lines will remain muted to avoid background noise. And all of these options are located at the bottom of your screen in the Zoom menu. I'm now going to pass things over to Dr. John Swagert, CEO of Mountain Park Health Center, who is going to be our moderator for today's session.
Thank you, Danelle. Good morning, everyone. Thank you for tuning in. So yeah, we're going to jump right in the deep end and talk about COVID-19 here first off. So I think, it's clear to everyone that if you try to imagine a better stress test for the entire healthcare system, you'd be hard pressed. And clearly this was tested and stressed, and we can all acknowledge that there were some gaps exposed in that process. But I think it's also would be hard to imagine a public health crisis that community health centers were better suited to address, at least the ambulatory care portion. I mean, we all as community health centers are here to disseminate information, accurate scientific information in a way that people can hear it. That's been critical in this crisis. We're also here to screen for disease, and clearly that was it has been and continues to be a major part of what we're doing. And then to deal with prevention in terms of behavioral advice and so forth, but also, of course, culminating in the vaccine that's been so rewarding to be part of. And of course, we need to accomplish that in a way that counteracts the inequity that's unfortunately so much a part of our current healthcare system. So I think we all know that we're all feeling confident that the worst is behind us for the pandemic, but we've got a lot to learn here. We've got a lot to be proud of, but lessons to learn too. And so today we've got some important voices to listen to, and important perspectives. And I'll refer you to your packet information for more detailed bios, but in brief, we've today got three panelists. We've got Jessica Rigler, the Assistant Director of Public Health Preparedness at the Arizona Department of Health Services. We've got Jonathan Nez, President of the Navajo Nation. And we've got Dr. Eladio Pereira, Chief Medical Officer of the Mariposa Health Center. So as Danelle alluded to, the format today will be 10-minute presentations from each of our panelists, and then we'll use the balance of the time for a Q&A session, and she'll help us get through that and navigate the technology here for your asking questions. So I think first off, we'll ask Jessica to provide a state-level perspective on the lessons we've learned as a state from COVID-19 and what opportunities are going forward to ensure continued success with COVID-19 response efforts. Jessica, the screen is yours.
Thank you so much, John. Good morning, everyone. Today, I'm going to provide just some very brief remarks about ADHS's role in the response, some lessons we've learned along the way, opportunities moving forward, and I look forward to your questions and your sharing after this as well. But before I launch into my slides, I just wanted to pause to say thank you to all of you out there for being on the front lines for the last 18 months of this response. Thank you and your teams for doing everything you've done to screen, test, vaccinate, educate, support our communities, for working nights, weekends, everything in between in service, not just to your standard patients, but all Arizonans as you've opened your doors. Just that remarkable unwavering support from Arizona's community health centers, leaning in to extend those comprehensive services that John was just talking about that you've always provided during the unrelenting pressure of this pandemic has been really critical to protecting Arizonans. And you have my endless gratitude and the gratitude of the department too for all of your work. Next slide, please. I'm sure many of you remember the early days of the response, and in public health, we talk about what we were doing the moment we found out about the state's first public health case. We've got a 24/7 on-call system and public health for infectious diseases, and our teams get really excited when they get to work on that next new thing. Of course, we had no idea that last weekend in January and all those weeks that followed how this novel coronavirus would turn into the global pandemic we're in today. But you'll see at the top right an image of our Health Emergency Operations Center, or HEOC, near the start of the pandemic in February. Of course, this is before any mask or social distancing recommendations came into play. And the department activates the Health Emergency Operations Center whenever it looks like the agency will need to respond to some kind of a public health emergency that needs coordination across multiple areas. And we follow an incident command structure so that we can be scalable. Usually our operations centers open for days or maybe weeks. And I'm sure it will come as no surprise to you that we're still open today, although we've moved to a virtual posture since pretty early in the pandemic to support all of the coordination that's required for COVID-19. Like with any other novel disease or outbreak, our epidemiology, our laboratory teams took the front seat early on, working with our federal partners and our local public health partners to quickly identify new cases of disease through testing and making recommendations for disease control and prevention based on the information we had at the time, which, as I'm sure you all recall, has really changed since the beginning of this pandemic. In the background of doing all of that work, we also were identifying and preparing any tools that are provided to public health for emergency response through statute, like isolation and quarantine orders or enhanced surveillance advisories that could improve data collection for something novel. And you'll see on the bottom right with the picture as well that we were conducting one of our other duties, which is to keep the public informed. And this is the back of the room at one of those first press conferences that Dr. Kristen, the governor, held, again, before masks and social distancing were a recommendation. Next slide. As the outbreak continued to grow around the world, the state public health response expanded in partnership with all of you. You can see a press release here where we announced the very first tranche of funding that was awarded to public health to support this response. It was $500,000. I think you all know through future funding opportunities and the American Rescue Plan that's coming, there are billions of dollars that will start flowing in to support public health, community health, and infrastructure response around the state. But at the time, $500,000 was a really huge deal. But I'll just stop and say something that I know you all know too well. Our systems are underfunded, and often our funding is very, very siloed, which means that we have to focus on super specific activities versus cross-cutting or strategic priorities that we may have. And so that's been a challenge as we've navigated through this. In those early days, we were just getting started with our data collection as well, and you can see kind of a chart of our early thoughts about what a dashboard could look like as we presented data to the public. I know you've seen our dashboard evolve over time, and I'm sure you can think of better ways that we could present that data or better data that we can have. For example, we have a lot of unknowns in the race and ethnicity categories across all of our types of data, which shows us we've got a need for improved data collection and opportunities to improve the matching of data across multiple sources that we have so we can better complete records and improve our understanding of our communities that are most impacted. Also, I've alluded to the fact that we've had all of this changing guidance. You can see in the bottom right, this picture, this is when we didn't know what PPE was supposed to be, right? And so we were advising all the public not to wear masks. In this photo, we were meeting an airplane that had repatriated Arizonans from a cruise ship who had been exposed to COVID. And there's that juxtaposition of me as a member of public health and no PPE combined with a flight crew who's wearing full Ebola-style PPE. It was a very confusing time in the beginning, and we had to navigate through all of those changes to figure out the best way to keep our communities educated on what they should do while we were still learning ourselves. Next slide, please. I just have a couple more slides to flip through to highlight public health's role in a situation like this. Again, there's a shot of our dashboard that has evolved over time to include even more categories. I know many of you will recall very fondly last spring our attempts to boost testing, where we launched the Arizona Testing Blitz. And so many health centers participated in that from the farthest corners of the state in order to provide testing opportunities to their communities. It was really the first time in the response that we contracted directly with community providers. Typically, we pass funds through to local health departments who then fund community partners. But we launched this to normalize testing and improve detection of COVID-19 in the community. And many of you may recall those early days when there were not great supplies for specimen collection and laboratory testing turnaround time was really very long. Now we've got pallets of nasal swabs at our warehouse. But then I was taking counts individually on a daily basis from providers so we could ship a little bit of a time out to just cover who you had booked for appointments at your testing sites. Other innovations that we implemented nearly a year ago include healthcare-specific innovations for the inpatient system, like the Arizona Surge Line, which we built to ensure that patients were able to receive the right level of care no matter where they lived. So it's really become a national model. We facilitated nearly 7,000 transfers since inception to ensure that if people presented and needed intensive care and their hospital was completely full, we were able to get them transferred to a place that had beds. And that really did help with some of those health equity issues and resource issues we face across the state. We did some other things with the inpatient system to ensure they could handle the surges and cases that we saw in the hospitals, including our surge staffing initiative that provided nearly 900 nurses to hospitals across the state. instituting post-acute care capacity tracker so that hospitals could get visibility on step-down beds that were available so they could facilitate timelier discharge out of their facilities to the appropriate unit. And we also funded beds at behavioral health and post-acute care facilities so that we could help patients get placed in a way that they needed to get placed when they were ready to come out of the hospital, so we could decompress that hospital system. These were all desperately needed and utilized during our healthcare surges, and their success demonstrates truly the innovation and collaboration of Arizona Public Health and our healthcare systems. Next slide, please. In this slide, in the center, there's a photo showing Dr. Christ at one of our warehouses. And many of you, through your local health departments, likely received some of the millions of N95 masks, gowns, gloves, other PPE items that have passed through our warehouse. We also passed through gallons and gallons of hand sanitizer, hundreds of ventilators, hundreds of thousands of nasal swabs, and rapid test kits. ADHS, as part of our preparedness plans, is prepared to order, receive, and distribute products during a public health emergency, but there's never been anything at this level or to this sustained response. So our warehousing capacities really had to grow during this. But our partnership with the local health departments really supported the further distribution of all those products so they could reach more deeply into the communities. And of course, ADHS and local public health, community public health continue to perform the bread and butter of what we do, like conducting case investigations or contact tracing in support of local partners, or issuing guidance to the public or to healthcare facilities or other settings like businesses, schools, correctional facilities, faith-based communities. Every segment of our society was really interested in recommendations specific to them in a way that was simple and streamlined. And we've recognized that we've got a lot more work to do to establish partnerships with key community sectors so we can further expand our reach to these various groups and work with additional partners to amplify those messages. Next slide, please. We're at a place now where we're moving toward recovery, and I know many of you can feel that. As a society and as a public health and healthcare system, we've really been through a lot. About 875,000 Arizonans have tested positive for COVID, and there have been almost 10 million diagnostic tests performed here in the state. We saw these tremendous surges in cases in the summer and again this winter that nearly overwhelmed our hospital systems. But now we've got a vaccine here, and over 3 million Arizonans have had at least one dose of the COVID vaccine. That number continues to grow every day. And if we can continue expanding vaccinations through more focused efforts that really reach deeply into our communities to meet people where they are, I know we'll be able to avoid further significant surges in cases. Next slide. It's got a couple maps up here that show testing and vaccination sites and how widespread they are throughout the state. But of course, you can see we still have gaps. Partners like all of you at community health centers, our pharmacies, primary care offices are all critical in filling these gaps to make both vaccines and testing continuously available to our community. And I'm showing these screenshots of our website, acknowledging that not everyone has access to the internet, or if they do, that they even know how to navigate to the website or to these specific pages to identify where these testing and vaccination resources are located. And that's why it's so important to work with multiple spokespeople and channels to ensure our communities have the information they need to be healthy, and it's a constant job to do. Next slide. We've worked to expand our strategies, launching vaccine influencer campaigns, and we've got more planned. There's lots of vaccination sites, both large scale and very, very small community focused sites, and we're working to take those sites on the road so we can set up special events in convenient community locations that community leaders identify as a need. We're working to try to do a better job of integrating activities instead of having all of these silos and maintaining them. And that includes trying to spread out all the funding that's coming in and coming through so we can connect everything together. The infrastructure that you all have built over decades is primed to conduct this multifaceted work that we have to do to recover from COVID-19 by offering testing services and vaccinations, but also the referrals to support the needs of your patients. And we're thinking forward towards recovery. We know so many people have delayed care, and they're going to be coming through those doors to receive those shots that their kids are missing, or their diabetes care, or maintenance, or support for substance use disorder. I mean, you know this runs the gamut, and so we're ramping up for this next response, which is the recovery. Next slide, please. As I look ahead to what's next, we keep talking about a return to normal, but now's our time really to think about what normal looks like. We're getting more funding streams to support health equity, and we need to look at how we integrate that core tenet of public health into everything we do in a really strategic way. How do we make sure we're using that funding to have a positive outcome for people who are disproportionately impacted? And, we've been working for years on addressing social determinants of health, and we have this dire need for continued and expanded integration across all of our sectors, not just community health and public health, but Medicaid and housing and education, pulling everything together to achieve these common goals. We've had some tremendous lessons learned and successes that we can expand upon, like telemedicine or the coalitions we've built, and further engagement of outpatient providers who are really on the front lines of public health, as well as expansion of our community health worker programs. Next slide, please. For those of you who aren't familiar, we also have an Arizona Health Improvement Plan, as the counties all have these as well. And you can see what our next iteration of the plan looks like from 2021 to 2025 and see our core areas for the plan. This plan really engages community partners to work towards these efforts, and we've got groups set up to address each of the areas of the plan that you see on the slide. I would really encourage you to get involved if you're not already, because I think the partnerships we forged through this COVID response will really help us press these priority goals forward as we're looking towards recovery. Next slide. And so I'd just like to close the same way I opened, with a thank you, truly with gratitude, not just for your time today, but for your time throughout this response. I'm so appreciative of my fellow presenters for their tireless dedication to communities, and grateful to all of you for your unending service. We're all public health, and I thank you for being there every step of the way.
All right, terrific. Thank you very much, Jessica. Appreciate that. And on behalf of all the community health centers in the state, we just want to express our thanks to you and the rest of your team for helping us get through this and coordinating all these efforts. And we look forward to continued success on those fronts. So next we have our next panelist, President Jonathan Nez of the Navajo Nation, and he's going to provide a regional perspective on how COVID-19 has impacted the Navajo Nation and actions he and his team have taken to protect tribal members. So let me turn it over to you, President Nez.
All right, thank you. Good morning, good afternoon for those that are on Mountain Time. Jonathan Nez, President of the Navajo Nation, and appreciate the words from Jessica. And I do also want to say thank you to the Arizona Alliance for Community Health Centers, the Collaborative Ventures Network, and our sponsor, the Arizona Complete Health, for allowing us to share our resilient story here in and on the Navajo Nation. I too want to say thank you to our frontline warriors and our lady warriors that have been battling and pushing back on this virus, COVID-19, for over a year now. And being allowed to present at this annual conference is historic, and as well as it is my honor to share with you all what we've gone through here on the Navajo Nation. Early on, as the virus came across the ocean into the northwest part of the United States, we here on Navajo realized that this is a virus that may hit our homeland. So what we did on the onset is develop our own Navajo Nation COVID-19 preparedness team to monitor and also to get information out to our Navajo people. And so, as you all know, the virus has gone to all 50 states, but at that time, the Navajo Nation was out there informing our citizens to be very careful, especially when it came to traveling, and to get the message out there of wearing masks, social distancing, and staying at home as much as you can. So once the cases started to come up around the Navajo Nation, the last state that is around the Navajo Nation is the state of New Mexico. Once the state of New Mexico confirmed its first case, it surrounded the Navajo Nation. And before we, Navajo, got our first case, we issued out a public health emergency and to bring in resources to our frontline warriors. Once we began to prepare more and more, of course, the virus, the virus is very contagious. It came into our nation, and it spread pretty quick. And from that point on, we were hit hard, and I'm sure you've seen early on the reports that per capita Navajo was #1 in daily case counts for some time, because this is a virus that was very new to the Navajo people. Getting information to our Navajo citizens was key, especially in terms of how to translate some of these health terms, scientific terms, into the Navajo language. On the onset, that was difficult, but we felt like utilizing our way of life teaching would also help. In Navajo, we call this the kosinskagi nast. Basically, that's the big cough or the big illness with the 19 attached to it, because we need to begin to develop concepts and terms here on the Navajo Nation that are scientific as well. And so once we gave the name to COVID-19, we began to get the information out. And when I said we use our way of life teaching, we hear stories of since time immemorial, the history of Navajo being here on the earth. And our way of life teaching has said that there were monsters that come to plague our people periodically or permanently. And since time immemorial, we've heard stories about the hero twins fighting these monsters off throughout the history of the Navajo people. And so we framed it in that way to share that with our Navajo people. And guess what? The elders understood that. And once the elderly understood how we were labeling this as a monster, I think it was easier for our elders to encourage, I'll say that lightly, our younger generation to listen to the healthcare experts, to listen to their leaders. And if you're fighting a monster, you need weapons, you need the armor. And so what are the weapons in the armor? The armor is the vaccine, and the information is the weapons to push back on this virus. And so we began to get the message out on a weekly basis. And we still do that today, Tuesdays and Thursdays, except for today, we weren't able to do it because we're waiting on data, but getting information to our Navajo people, translating it into the Navajo language so our citizens can understand what's happening, and to answer questions. In our town halls, we had folks like Dr. Anthony Fauci. We also had people like Dr. Burla from Pfizer, our very own Navajo healthcare physicians, and just answering questions. And I think because of that, we were able to bring confidence to the vaccine. And right now, I'm sure you've heard that the Navajo Nation has put close to 90% of what we receive from the federal government vaccines into the arms of our Navajo citizens. As a matter of fact, I do apologize for my appearance today. I had a reflector jacket on earlier, but we were out at a vaccination event today. As you know, 12 to 15-year-olds are now able to get the shots. And this is key. This tool, this weapon here, social media, is very powerful, and to bring people out and to encourage them to get vaccinated. Here on the Navajo Nation, the enrolled citizens is close to 400,000 Navajos. And about 175,000 of those Navajos actually live on the Navajo Nation. So you have a lot of our Navajo citizens living off the nation, but then they get their primary health care here on the Navajo Nation. So when we received our vaccinations, and by the way, we received our vaccinations, our shots the same day everyone throughout the country received the states, because we advocated with the White House and the AACHC to make sure that we get our share of doses. And once we received that, the great team here on the Navajo Nation, Navajo Nation is 27,000 square miles. We're in 4 states. You got Utah, Colorado, New Mexico, and Arizona. And so with 175,000 actually living here, the last statistic that I received was that about close to 70% of our Navajo citizens, our Navajo residents, have been fully vaccinated here. So what's the threshold? I get a lot of definitions of herd immunity, but I think we're pretty close. And it's because of how we framed the discussion, how we got the information out to our Navajo people. And now we've seen some very high percentages in vaccinations here on the Navajo Nation. So I wanted to focus a little bit more on the vaccination, and just also appreciate the healthcare folks that have been on the front lines, getting the message out. Those from the Arizona Department of Health, many of these organizations that are viewing today, thank you so much. You came to assist us during a time when the CARES Act was being debated and being held from Indian country, but we had to take the feds to court. But that's a whole nother story. That's a whole nother 10 minutes. But all I want to just say to everyone is that we appreciate the friends of the Navajo Nation who have come out to help, and you all are part of the success. And Dr. Fauci said it himself too, and I'll end with this. Navajo Nation could be a model, or is a model, a case study of how you can push back on COVID-19. And what's difficult at times is that jurisdictions around us sometimes don't take this virus seriously. And we have to deal with that. But here on the Navajo Nation, we still have a mask mandate, even though CDC has said, check those masks. But we're saying we're going to continue to do that because the health experts have been correct all the way through. The scientists have been very helpful throughout this process. And we just appreciate everyone that's attending this conference, this annual conference today, and helping not just Navajo, but helping each other out. We're all in this together. We're so interconnected, more so than ever before. Whatever affects Arizona does affect Navajo and vice versa. But at some point, our nation is still closed to our visitors. We're just taking these small baby steps to reopening. And I just ask for our friends and our visitors to, for their patience and their consideration for how hard Navajo has been hit. But we will bounce back. And that's the story of the resilience of our Navajo citizens, and really just all 5-finger beings. And we're all 5-finger beings. So thank you so much for the opportunity to share our story.
Thank you, President. As that was really inspirational leadership and really outstanding lot. There's a lot there that we can learn from, and appreciate your words very much. Congratulations on some tremendous results. Next up, we'll hear from Dr. Eladio Pereira, sharing his perspective with us on the role that health centers have played and his part in Santa Cruz County. So without further ado, Dr. Pereira, please take the screen.
Thank you, John. And I'd like to thank the Alliance for inviting me to present. Of course, AACHC as well has been very helpful to us. Arizona Complete Care for their support, and our sponsors, want to thank Danielle and Vida for putting this together. You know, you may know that Santa Cruz County is the smallest county in our state. Mariposa provides a lot of the healthcare in our county. And what I thought I would do this morning is spend about 10 minutes reviewing what our responsibility was with the vaccine. I remember when we first got our shipment, December 22nd, our Moderna shipment were all ready, and began vaccinating the same afternoon. We got the shipment in the morning and we began vaccinating. So I'd like to spend 10 minutes reviewing our process. It would be mostly big picture kind of thing, but I'm happy to answer any questions. Next slide, please. I think the most important aspect that we learned early on is that you need to create those partnerships. There's really no way for Mariposa to do this without the assistance of a lot of people. And I've included some of them here. That includes the city of Nogales, Santa Cruz County, some of the law enforcement agencies, such as Nogales Police Department, Nogales Fire, Rio Rico Fire, as well as the school districts, in addition to some of the volunteers and the staff. Early on, the first thing we did was to meet and figure out that this is something we needed to do. At that time, testing was being done fairly often, but we knew that we need to shift resources to vaccination. At the time, testing again was important, but over time is becoming less relevant. The way to mitigate the pandemic is through vaccination, not necessarily testing. So we have to allocate resources to the vaccine effort. Once we created some ground rules in terms of the goal of vaccine and creating this partnership, we had a lot of decisions to make. Next slide, please. We made the decision to use the Nogales Multipurpose Recreation Center, our main hub for vaccination. This is a picture from a drone taken looking north. It's a pretty significant facility. It is protected indoors, and we decided that this was pretty central for the county to undergo the activities. Next slide. I've included some of the decision points in the preparation for the vaccine. I'm not going to cover all of them. I'm happy to answer any questions. The key features include the creation of partnerships with local officials and institutions. One of the main decisions early on, as you may recall, whether to do drive-through vaccination or not, we decided not to. It just didn't work for us. The space that we had at the rec was just too small. The vehicles take too much space. We counted how many vaccines we could do drive-through, and it was about 300 a day. We also calculated how many we could do in person, and it was close to 800 a day. So we decided not to do drive-through. But there are a lot of decisions to be made, how we manage the vaccine from the time it arrived. We already had the deep freeze refrigerator or freezer available for the Pfizer vaccine. We didn't get Moderna, we didn't get Pfizer until later on, but we are already preparing to get the Pfizer vaccine. We got Moderna and Johnson & Johnson first. How to document the arrival of that vaccine, and most importantly, the handling of the vaccine. In Santa Cruz County, we administer all three vaccines at the moment, Moderna, Johnson & Johnson, and Pfizer. And all three vaccines are different. We spent a lot of time making sure that the staff was trained in the proper management of the vaccine. Also, transportation of the vaccine from our main site to the recreation center to other sites that we held vaccinations, including homes, our jail, etc. So transportation was a very important piece. We had to figure out how to make appointments. Early on, there was no online system. Our colleague, the Santa Cruz County staff, was able to schedule close to 25,000 appointments for a few weeks, and they were very, very helpful. You may recall adherence to the guidelines was challenging, the 1A, 1B, 1C groups. Who goes first, who goes second. That was quite stressful to make sure we adhere to those, but we did our best. We vaccinated healthcare workers first, and then we move on to other groups according to state recommendation. We were concerned about the site and vaccine security. We went ahead and requested every time the vaccine had to be transported, we requested police escort to be certain that the vaccine was protected. We also had security at our vaccination site to make sure that the vaccine was safe. We did a lot of staff training as well. Next slide, please. One of the challenges we had was to manage all the vaccines and sort of keep them separate to minimize any errors. Early on, we decided to administer only one vaccine per day per site. You see those there, Johnson & Johnson, Moderna, and Pfizer. You see the deep freezer there that we have at our main site. That was certainly a challenge. Now we feel comfortable. We now can do 2 vaccines on the same site, but certainly that takes a lot of training and a lot of workflows to make sure that the errors are minimized. Next slide, please. The execution involved, as you may know, management of our parking, which is a big deal. Working on workflows from the arrival to exiting, meaning arrival, registration, vaccination, monitoring, and the exit. Our goal was to get people in and out in about 30 minutes. We were able to do that. We had about 80 staff at the recreation center. Mariposa had about 40 staff. That was over 10% of our workforce, and another 40 staff from the county and volunteers. We've been doing 500 to 700 vaccinations a day. Yesterday, we did 798 vaccinations a day. We had about 16 tables to register patients, and up to 10 vaccinators with scribe. We learned to have scribes for each vaccinator. We heard that was being done at State Farm, and we went ahead and instituted that pretty quickly, and that was very, very helpful. We have three to 6 people monitoring patients for 15 to 30 minutes, depending on the history. And we had about 3 people monitoring the patient flow from registration to vaccination to the monitoring area. We designated 1 table to prepare the vaccine. Mariposa had 1 table staffed by a clinician to answer questions, and that was a very good decision early on. One of the main ways to work with vaccine hesitancy is one-on-one education. I'm so glad we had a physician there at all times. We have registered nurses and EMTs that can help us take care of any possible reactions. And our colleagues at the county and health department also have 1 table to handle other issues related to the recreation center. Next slide, please. We went ahead and did a short 30-second video about the walkthrough at the rec. I'd like to show you that, and then we'll move up to monitoring. So please, if you could play the video, that would be great. Thank you. So the average time it took was about 28 minutes from from arrival to exiting, and we're very fortunate to have the support of everyone. We took monitoring seriously. We just didn't see how you could be in a car and be monitored. Our reactions were minor. We had a few that were more serious, but the minor reaction were mostly anxiety, presyncope, syncope, facial numbness, arm pain, dizziness, and we had a couple of patients with hives. Had one significant reaction of anaphylaxis, and all the significant reactions were reported to the VERIS system. We did have emergency medications available on site that included Benadryl, corticosteroids, H2 blockers, and IV fluids, and we used those on a couple of occasions. We had a couple of people that had to be transported to the emergency room. But monitoring was key, particularly if during the first dose, you want to make sure that patients are not disqualified for the second dose. We felt that at the time, some of the reactions were being used not to vaccinate the second time. We decided not to do that. We're very careful because the second dose offers maximum protection. So the monitoring and the diagnosis was very important for us. Next slide. So this is a picture of the wreck. So in the left upper corner, you'll see the registration tables. We have 16 tables available. The picture in the middle upper portion is the monitoring area. As you can see, we added 3 more tents on the left side when we need 11 vaccinators. The left lower are supplies. We have one of our nurses, Brenda Coppola, drawing the vaccine. And then on the right side is also some of the registration tables. Next slide. The outcome has been pretty remarkable. I included this slide. It's a couple of weeks old. I look at the AACHC dashboard this morning. We have done 51,687 vaccinations. If you look at eligible patients, meaning 12 and above, that's about 39,000, and we have vaccinated 76%. Fully vaccinated people, 62%. We hope to end our campaign the week after June 11th. At that time, we have vaccinated most of the people that we thought would want to be vaccinated. Next slide. I'll finish with a couple of things on lessons learned. I think as we look at the future, the creation of partnerships cannot be emphasized enough. You have to work well together towards a common goal. You have to leave your differences aside and bring allies to get things done. You have to work well with others, particularly those individuals who are not in medicine. You have to figure out which resources you want to allocate to. During this time, nothing else was more important. As you know, COVID-19 was essentially killing so many people, and there was nothing more important. So we went ahead and dedicated all the resources we needed. We adjusted quickly, a lot faster. I know that's sometimes really hard. We assigned someone to review the medical literature every day. Every morning, someone will look at the literature, look at trusted websites, including CDC, Johns Hopkins, Mayo Clinic, to make sure we were making changes accordingly. And masking was just one of them, but there were a lot of things that we needed to change. You need to make pivots very, very quickly, literally from one day to the next. And then finally, I want to emphasize what President Ness said about education. One of the main things we did early on was to educate people and also answer questions and be truthful with them. Sometimes we had an answer, sometimes we didn't. I cannot tell you how many times we have called Pfizer, how many times we called Moderna and Johnson & Johnson to review some of these questions because we don't know the answers to all questions. We will do our best. So patient education and one-on-one education certainly has been critical for us. And I think that's about 10 minutes. I wanted to finish on time and happy to answer any questions. Thanks to everyone, ADHS and others who've been great with us. And of course, I want to make sure I go back to my first slide that without our partners, Mariposa would not have been able to do this. I think our county health department and others have been just fantastic. So thank you.
Thank you, Eladio. Great presentation and obviously very impressive degree of organization and terrific results. Very, very impressive. All right, with our remaining time, I think we want to move on to questions and answers. And I guess the first question that we had come in was I'll address it to you, Jessica. That it has to do with pushback and negative attitudes toward public health and safety measures that have been in place to protect people from COVID-19, such as masks and social distancing and vaccines. And this negativity and anger has made things more challenging. And I guess the question is just in general, what strategies do you see as most effective to deal with this in the public's dialogue over this issue?
Yeah, it's been a tough year, right? I mean, there was so much going on during 2020 on top of the pandemic. And so getting some of these messages out was really difficult. And the science sort of changed over time. This was a novel virus, and we didn't know what we didn't know in the beginning. And there wasn't any research into it. Was it aerosol? Was it airborne? Was it person to person? All of those things weren't known in the beginning. And so you really have to ask the public to trust you and kind of come along with you. And so part of doing that is explaining what you do know and what you don't know. And that's a strategy we've used during Zika as well and other kinds of novel outbreaks, really trying to get people to understand that science doesn't always have all the answers right away, but trying to engage that community trust that we will share the information when we know it, and that information may change over time. But meeting people where they are is very, very important. And I think we can do a better job at utilizing trusted community messengers to help reach some populations who may not be as trusting of the government or as of public health in general.
Great, thank you. Danelle, can you help me now manage the other questions that look like they're coming through on the chat line? I'll turn it over to you to ask the next one.
Yes, absolutely. Our first question in the chat is, do you think there will be a third dosage?
So a few days ago, Pfizer said they don't anticipate a booster for this year. It looks like immunity may last longer than they think. But that's just Pfizer. Not sure about Moderna and Johnson & Johnson. We'll see. We're already preparing for that booster to do exactly what I just described, to do it again around September, October. You got to prepare for that. But a few days ago, Pfizer said that they don't anticipate a booster, but we'll see what happens.
Thank you, Dr. Pereira. The next question, there was a comment just on how impressive our results are as a state in vaccinating people. Has there been a challenge or another approach to getting people to finish that second dose to be fully vaccinated?
I'll tell you what we've done. That's a good question. It's a great question. We don't underestimate the challenges of the second dose. So Pfizer second dose is 21 days later, Moderna is 28. What we decided to do was to give people options. So, we scheduled the second dose 21 days, but if they could not, we look for other options. It could be day 20, it could be day 19, it could be day 23. So you got to give people options to get them back. I think that's been very, very helpful. I think sometimes people push too hard for day 21 and 21 for Pfizer, 28 for Moderna. So that's worked really well for us. We also keep a listing of people who have not come for the second dose. We've been contacting them. And then finally, there are populations that really benefit from Johnson & Johnson. So one dose, I don't need to come back. In fact, before this presentation, I was at the recreation center this morning, and we have 5 truck drivers who were scheduled to come in. And I talked to all 5, and we decided to do Johnson & Johnson for them. They're gonna be somewhere in Tennessee, day 21. And so they said, why don't we get Johnson & Johnson? So we use Johnson & Johnson. So I think you have to work with each people. You have to be flexibility. And I like Jessica's comment about you got to meet them where you are. And that's what we've done.
All right, and other panelists, feel free to chime in on any of these questions. The next question is, with the sudden changes happening with COVID guidelines, which I think a few panelists may have referenced, how are you and your organization adapting and identifying ways to keep your population safe? We heard from President Nez that Navajo Nation is maintaining a mask requirement. What are others doing?
From the state perspective, as the guidelines change, we try to get the message out as quickly as possible. Sometimes that is a little bit clunky, right? It's through a tweet or through a blog, which isn't going to reach the entire population to try to communicate that message. And then after we get the initial message out, we try to expand it further. But it's difficult because I know everyone on the panel, many of you are seen as experts in your communities. And so when guidance gets dropped in the news media, and that's the first time you're seeing it too, you have to rush to respond and answer the questions, seeing everything at the same time as everyone else does. And so it's really about making sure, at least at the state level, we've got subject matter experts that's kind of their job, is to monitor all of the changing guidance. And so we've got people on board who can just cull through and pull together those recommendations so we can very quickly get some public messaging out around what those changes are.
President Nez, were you going to say something? I saw you come back on camera for a bit. Okay. Our next question is, how has your community reacted to including 12 to 15-year-olds? That's a great question.
We've had a great response so far. In fact, it was almost a celebration. In our case, so that happened last Wednesday. We were expecting CDC, Rochelle Walensky, to sign off that morning. It didn't happen that morning; it happened a little later. But we had booked appointments for that afternoon, hoping that CDC would approve that morning. And I remember, we booked appointment for 1 o'clock for the 12 to 15, and it was 12:30, and we still had not received the final confirmation. And finally came through. Our health department contacted AACHC, and we got the green light, and we allowed people in within 30 minutes of CDC approval. And since then, we've been vaccinating a lot of kids. So very well received. Parents wanted. We had an interesting situation where sometimes parents had not been vaccinated because they wanted to be vaccinated with their children as a family. So we've seen that. So we vaccinated them too. So well received for us. I don't know what the experience has been in other places, but for us, it's been good.
All right, I actually don't think we have time for any more questions, but I just want to express my sincere gratitude to all of our panelists, to Dr. Swagert for moderating this session. I thought you each brought really important perspectives to this session, and I'm just so appreciative of your time. Next up on our agenda, we have the state legislative wrap-up and federal health center movement session. We are going to take a 10-minute break. You can remain in this Zoom webinar. You don't have to have a separate link. And we will resume at 12:05. Thank you again to our moderator, panelists, and to everyone who attended this session. We look forward to seeing you again in 10 minutes.
Thank you,
everyone.
Danielle. Thank you, John. Take care.
Thank you.
Thank you, everyone. Much appreciated.
Uh-oh, I can't hear you. Uh-oh. Is that?
There it is. How are you? Now I can't hear you.
How about that? How's that?
Good. I think we've got it now. Yeah. Yeah, I heard you call in a little bit earlier and then
I was just so eager.
Well, this last one was really interesting, you know, having President Nez from the Navajo Reservation talk about what happened in Navajo and how they dealt with the COVID-19. They did an incredible job.
Apparently. Wow.
Yeah.
All right, I'm glad you both made it on. I'm going to go ahead and start running the rolling slides. And then right at 12:05, well, it may be 10 after, we'll get started with the next session.
I can consolidate mine. I'm good. Yeah, so no problem. You do what you need to. You can still give them their 10 minutes.
Great. Yeah, we'll plan on starting at 10 after, and then I will introduce you all, and then I'll hand it over to Tara.
Hey, Tara, when did John leave?
October of 2020.
Yeah. But you and I worked together through the COVID crisis.
Correct.
We started early.
We did.
I'm going to mention that you were, you know, both you and John. I don't know how I would have done it without you guys.
Well, you've been a fabulous partner and colleague. I appreciate it.
You too. You know, it's just interesting.
Admiration here.
What's that?
I said there's a mutual admiration here.
Definitely on my end. I just tried to think of what I was doing the year before, and it was a blur to me. It was a blur.
Oh, I know. Yeah.
Well, I'm gonna grab a quick cup of coffee.
Okay.
So and I don't want you to have to hear all the gurgling.
All right.
I'll be back in 1 minute.
Okay.
For this award, we're really acknowledging your sponsorship of HB 2392, which has opened up the avenue for community health centers to receive Medicaid matching funds for community-based graduate medical education programs. It's a fantastic accomplishment. It is already getting national attention because of the impact that this can have on rural communities. So thank you so much for your advocacy, for your sponsorship, and your continued dedication to community.
Thank you very much. Thank you. And this has been an honor and a privilege to carry this legislation. You know, you said it well, community, and that is what I have truly been about in my life, what we can do to give back. And part of community are our doctors, are our physicians, and especially in the rural areas, how important that they are to the communities everywhere. We need to fill the pipeline for physicians,
primary care doctors within the state of Arizona. The growth that is coming upon us is substantial, and whatever we can do to highlight Arizona as being the place for residency programs, for being the place for our future doctors, we want to do that. And it's just really been a joy for me to be able to bring this bill, bring this to fruition, seeing the governor sign it, and I'm very excited for the future and for primary care doctors in Arizona. So thank you. Thank you.
I'm the CEO at El Rio, and with me is my colleague, Dr. Clinkers from Marana Health Center, and we're delighted to be here today because we have Randall Freeze with us. He's a physician here at the university, and we are honoring him as the 2021 Legislator of the Year. Right, because he has been an amazing support in some very successful legislation for federally qualified health centers this year. It's the GME legislation that will expand residency sites for FACPs in the state of Arizona. You know, as a physician, Dr. Freeze really knows about the importance of the comprehensive health services at FACPs, and also how important those residency slots are to the care of our most vulnerable patients and populations in Arizona. So we couldn't be more proud to have you here today. And I'm going to ask Clint to say anything else you'd like to say. And also, yes, say a word. Welcome.
Dr. Freeze, thank you. We always appreciate the support. You've been a supporter for many years. So thank you. This is a welcome to the board. Thank you. Thank you very much for being here. Thank you for the award. Not only is educating physicians an important part, but when you educate a physician in Arizona, they tend to stay in Arizona. And that's really important for our community. Yeah. So thank you so much.
Yeah. Thank you. And you know, if I might add, your ability to waive that access financial fee really enabled this bill to move forward so easily. So and help people get it, right? That's right. So thank you for that. Yeah.
Thank you.
Hi, everyone. Hope you're doing well and enjoying the conference. My name's Alex Vactor, and I work with Community Health Ventures, NAC's business development affiliate. I wish we were together in person this year, but we will be soon enough. For those of you who don't know, Community Health Ventures leverages the national reach of health centers to secure discounted rates on products and services. Our programs include value in purchasing and value in benefits. It offers discounts on medical and dental supplies, health insurance, and much more. And we're proud to work with many Arizona health centers. Thank you for your work over this past year. Have a wonderful conference, and I look forward to being together again soon. Take care. Hi.
All right, everyone, we are ready to move on to our next session of the day, State Legislative Wrap-Up and Federal Health Center Movement. I'm sorry you're seeing this box in the left-hand corner. I can't seem to get it to go away, so I'm just going to leave it there. Apologies. In this session, we are going to talk about the role health centers. Oh, that is the wrong slide. Tara is going to provide a legislative update on here in Arizona, some of the highlights from our legislative session. And Steve is going to talk about what we're seeing at the federal level related to the health center movement and opportunities for advocacy going forward. I want to thank our session sponsor again, Community Health Ventures. Again, there are several ways you can engage in this session. You can send us a chat, use the Q&A feature, or you can raise your hand and we will unmute you. And all of these options are located at the bottom of your screen. Again, our speakers today are Steve Carey and our own Tara McCollum. And I'm now going to hand things over to Tara to get us started.
Thank you, Danelle. Thank you for the invitation and giving us the opportunity to talk about advocacy for health centers. So we were very busy here in Arizona this year. We've had a lot of legislation that we were either directly engaged in or that we were monitoring. So probably the one that you just saw on the thank you to our sponsor of the legislation, and in addition to that, another representative who helped us really get that over the line, Representative Joanne Osborne, the sponsor of our legislation for the GME program, and then Representative Randall Freese, Dr. Freese, helped us by removing any funding that was attached to the bill, because that really gave it more momentum going through. We have a legislature that doesn't like any kind of funding on bills. And so it really was helpful, and it really expedited it for us. So basically what this bill does is it creates a whole new program at Access for graduate medical education. And so for FQHCs that have graduate medical education authority and have actually been approved and certified, will be able to participate in the FQHC Medicaid GME program, which is different than the hospital one, which exists currently. And the hospital one came into effect in 1992. There's never been an avenue for FQHCs. Now there's an avenue. So I quickly want to ask Steve, do you have any idea if this has occurred in other states as a method to enhance the workforce pipeline for primary care?
Thank you. To my knowledge, Tara, no. I know that there have been other states who have tried to do this, and for a variety of reasons, they didn't work. But I think this is an innovative approach, and I commit to you that Colleen and I will work with you to see if we can help you get this through. So stay tuned. But again, I think this is a novel approach, and I'm not aware of any other.
Well, and it was signed by the governor, it's in law, and it will actually, Access now has until March 2022 to actually put this into place. So we're thankful for that. We actually have a staff person here, Victoria Burns, who used to work for Access and worked very closely in the GME program, who will also be helping with the boots on the ground. So thank you, appreciate it.
So Tara, real quick then. So you don't need any federal support. This is only state. You're good to go?
It's only state, correct.
Very good. Then congratulations. You should be proud.
Yeah, we got it. Then we're going to run a bill that would require that there would be a reporting mechanism for adults getting vaccines on the state AACHC reporting database. However, because of an apprehension about the anti-vaxxers, we kind of put that one on hold and decided that we were just going to monitor how things were going. So we didn't introduce that legislation. It was not necessary, but now we're battling an anti-vaccine legislation, which I will get to later. But that was kind of what our apprehension was. We've been assisting the Arizona Commerce Authority in securing funding from the state budget for an expansion in broadband services. We've not seen the state budget. Our legislature, which is supposed to be 100 days, is now well past that 100-day mark, and they have not resolved the budget yet. We're probably going to be into mid-June before we see a budget. But we are hearing that there is plenty of funding for broadband services and for telehealth. So fingers crossed that our information is correct and that we are going to get substantial funding in that area. Next was to monitor the social determinants of health bills. There are and were a lot of bills on housing, food insecurity, transportation, etc. Unfortunately, none of those bills really seemed to move forward this session, but we kept an eye on them and helped where we could. Then finally, extending telephonic codes past the extension of the public health emergency. That we felt was really important. Because in a lot of our rural areas, we are finding that especially our behavioral health providers are saying that it was a really critical need for connecting with their patients in those remote rural areas who did not have broadband capacity, maybe didn't have an iPad or a computer in order to communicate with them. So during the COVID crisis, that was really an important tool. And we would like to maintain that going forward because we think that it has a real viability and will really expand our access to healthcare. Next slide, please. So here's the outcome of the legislation. As I mentioned earlier, our bill on graduate medical education, 2392, was signed by the governor on March 23rd and was chaptered. So there's a 90-day waiting period after the legislature adjourns, but we know that access is already ramping up to get this one in place. Again, assisting the Commerce Authority with funding. There was another bill that we worked on very vigorously. It was HB 2454, a telehealth bill, and it's a parity bill, which requires commercial payers to pay for our telehealth services as well. And there were a lot of other components to this bill that went into it, but it became a behemoth bill. However, I think that while we didn't get everything we wanted, it really is going to help us in the area of telehealth. So that was signed by the governor on May 5th and chaptered. Then extending the telephonic codes, as I mentioned, is an ongoing process, and we're actually working with Steve and others to do it at the federal level as well as the state level. So that is just really a critical thing for us, is to make sure that there is reimbursement for the telephonic services and the codes and Medicaid, Medicare, as well as our commercial. Now we have the commercial as well. So then also we monitored mandatory reporting of the vaccines. Again, did not introduce the legislation, but it appears that it is going fairly well. So what we really have to do is get over the vaccine hesitancy, but for those who are being vaccinated, they're getting their cards, it's being reported, and we're pretty happy about how that's proceeded. Next slide, please. Also, this was kind of a late introduction of a bill, and we had a strike everything bill for our Medicaid agency access, and that would allow them to use their supplemental appropriation of $27 million for CHIP and $3.1 billion in expenditures for our access program, our Medicaid program. So we really ramped up the advocacy efforts very quickly, and we got this through, we expedited it. We got it through in record time, and it was signed by the governor on March 18th. I think it only took us about 3 weeks, which I think is probably a record, but there was a real recognition that that money for our Medicaid and our CHIP services were just very vital. And so there wasn't a lot of opposition to it, and we're very happy that we got that one through, because that means better opportunities for reimbursement for our federally qualified health centers as well. Then there were a lot of behavioral health bills, and I'm only going to touch on a couple of them. One was the Maternal Mental Health Advisory Committee, a 21-member maternal mental health advisory committee that will be going into effect, looking for recommendations for improvements on screening and treating maternal mental health disorders. That was signed by the governor on March 18th. Then We have the behavioral health professionals unauthorized practice, which really prohibits those people that are really masquerading as behavioral health providers from doing so. And that's kind of the quick and dirty wrap up on that one. But we worked very closely with the Council of Human Service Providers on getting those two bills together, as well as some of our other behavioral health bills. Next slide, please. So as with other states across the country, and there were many other bills, but those I just wanted to highlight a few because I don't want to bore you with everything we worked on this session. It was pretty voluminous. But as with other states across the country, we found ourselves faced with, I would call them voter suppression bills, but my Republican colleagues would say that they were voter integrity bills. And a lot of those bills were very, very problematic, would have put extreme barriers into vote by mail. And this time around, in the 2020 election, we saw over 80% of the voters using vote by mail. That is really significant. I don't know that we have ever seen anything that high, but I think it put red flags on things because we, in essence, became a purple state by voting for Biden and Senator Kelly. So I think it became very contentious for the GOP. And so we started seeing a flood of quote unquote voter integrity bills, which made significant changes to our voter process, from voter ID to the vote by mail, to the one that did go through and was signed by the governor. We called it the PEVL bill, and now it's EVL. So PEVL is the Permanent Early Voting List. And that's where most people sign up to get early voting ballots for every election. Now it's EVL. So if you do not vote in 2 consecutive elections, you are taken off that list and have to reapply, which is going to be very difficult, especially for students who go out of state for college and maybe miss an election, and for elderly people who may not have the ability to vote in that particular election, but would like to in a future election. And for a number of other type of voters who really rely on getting those permanent early ballots in their mail. If there is not good education around this, we see it as becoming very problematic and really being an impediment to our vote by mail process in Arizona. There was also a lot of pushback on equity and inclusion instruction in classrooms. And what this is, and again, this is the national perspective, it's a pushback on systemic racism. So the view is that if you teach the 1619 project, which basically focuses around the history of slavery in the United States, there is a feeling that that is a very one-sided approach. And if a teacher doesn't take that approach in addition to another view of how that history evolved, then they can be fined $5,000 for not giving a broad overview of that historical perspective. So that bill right now, it got through the House 3129, and it is sitting and waiting for another Senate hearing. We don't know if that is going to be scheduled. There has been quite a bit of pushback on that bill, so it'll be interesting to see. But I bring this up because it really is part, I believe, of what we have been facing with the voter suppression as well. So it all kind of is one package, if you will, that we're seeing not only in Arizona, but in other states. And then finally, I want to focus on the pushback on the mandatory vaccines, because other states are seeing that as well. And in this bill 2190, it basically prevents businesses, state, local, and county governments from requiring their employees to be vaccinated. So this is going to be interesting to see. It's still going through the process as well, and we don't know if it's actually going to get to the governor's desk, but the governor has been a big proponent of our vaccination efforts, and our Department of Health Services has done an extremely good job of pushing out the vaccines and working with us on this, as have our county health departments. So we're really hoping that this pretty much dies on the vine, and we're not going to have to deal with it further on going forward. So next slide. And this is where I hand it over to my esteemed colleague, Steve Carey. Thank you for joining me on this, Steve.
Oh gosh, it's my pleasure. We've been tied to the hip for so long, Tara, and I will tell you that before I proceed, Danelle, how much time do I have? I want to make sure I fit in everything. Can you give me the? You said 30 minutes, but I want to make sure I'm consistent with your clock.
Yes, I think 25 to 30 minutes should be perfect.
Okay, very good. Thank you. So Tara, I was listening to that. What an incredible summary. You know, I think that sometimes as we're providing care for the people in need, at least from the Hill perspective, I think some people have forgotten that there's another mission, that health centers are a tool for social change. So I'm struck by what you were talking about, the history lessons and the voting, and I agree with you. There is definitely a connection. So I wanted to acknowledge that, and I wanted to say thank you for being such a wonderful colleague. When I was asked to address this group, I jumped at it. I want to talk to each and every one of you before I proceed, and I want to tell you from my heart how much I appreciate all of you. We in DC are a couple of steps removed, and but you're making it happen every day. And so I'm going to give my report, but the most important thing that I want you to know is how important you are, what you do for human beings, and the power of you in getting your own funding. Doesn't happen in DC. We do a little tinkering for sure. Maybe we help on messaging, but it is what you do and your personal connection with your lawmaker. I wanted to hit that home. So with that, let's proceed. What I want to cover for you is, there we go, administration and the 117th Congress. So the Biden administration, the 117th Congress, just a broad brush view. A recap of the COVID relief package, the Biden package that recently passed, where we are presently, legislatively, politically, et cetera, and then some of our current Hill asks. And then finally, I want to drive home you and your impact and maybe what you can do to enforce what you've been doing in the past. And I'm happy to take your questions. So with that, next slide. As everybody knows, and I know that Arizona knows better than anybody because you're living it again, and I am sorry. We know that Arizona government officials have done this time and again since November, and that you're at ground zero and all eyes are on Arizona. But what we saw was a delay in action between the November elections and the swearing in of President Biden. And that had ramifications. It was a delay in the cabinet confirmations, and that limited his ability to use otherwise in previous administrations, federal resources, buildings, office space, and the payroll to allow people to crunch numbers for that next fiscal year and any emergency funding. And that had definitely an impact. Of course, the January 6th insurrection, that delayed things a lot, and it was more than one day. It really created a rift, and it's the worst on Capitol Hill that I've seen since I started working for my congressman in Michigan in 1989. I started out after the Marine Corps. I was working in the home office of a congressman. I did come into DC at the end of 1990, and there was a lot of comity then, and I don't see it now, but there's hope, and you could be that agent for hope. Secretary Becerra, he was only passed March 18. Thank you, Semper Fi, to you, Christopher. Got that note. Thank you for that. I've got the mug right here, so thank you. And by the way, ask questions anytime you want. I don't want to just lecture. That was a partisan vote. He didn't receive one yes vote, not one aye vote from the Republican side. A number of reasons why, perhaps his view on choice issues. They made the case that he was not informed on health matters. We do know that there were previous administrations, including Republican administrations, where there were former members of Congress or governors with even less health experience, but they were also good HHS secretaries, and we expect the same out of Becerra, because he does know what he's doing, and he's trying to bridge the gap. CMS Director Chiquita Brooks LaSure's nomination has been held up, not because of her qualifications, but because of the Biden administration's holding back on a CMS waiver. So it has nothing to do with her qualifications. They're just leveraging that to make some headway in Texas. There is no HRSA director at this point that's been announced. So we'll follow that and keep you informed. Can't get a straight read from the administration as to why. Could be, again, the delay, but we'll keep you posted. Next slide. Look at those numbers. Look at that red and blue. That is tight. That is extremely tight. What does that mean? Well, on the Senate side, it means that Vice President Harris has to cut or be the deciding factor for a lot of close measures. And we've already seen her do that. House side, the same. It's not 50-50, but it's darn close. What does this mean? It means the moderates carry a lot of weight. I would say that it is closer now than in recent memory. And the ramifications of this is that they've got to pull together more. And it's interesting. They've got to pull together in a way while they're still so far apart philosophically, largely because of the previous administration and the insurrection and so forth. So, and the Republicans were not fond of that COVID relief package, and that has caused a little bit of a rift. But President Biden is very well versed on diplomacy, and we expect him to be able to bridge that gap. By the way, you have a fantastic delegation. Sorry to see Kirkpatrick leave. Tara, I know that you've worked closely with Congresswoman Kirkpatrick, yes?
Absolutely. And she actually was an attorney for North Country before she even went into the state legislature. And,
wow.
And we met when she was in the legislature, and she's just been amazing for us. But I don't know if you saw our Legislator of the Year awards, but one of our Legislators of the Year, Representative Randall Faris, Dr. Faris, is actually running for her seat.
Interesting. Well, let's talk about that further. So sorry to see her go. As everybody knows, she's on appropriations, not on labor HHS, but I know that she towed the line for us when we needed that extra lift over the top on discretionary spending. Grijalva, the same thing. Congressman O'Halloran has actually been here where I am, behind where I'm sitting, just as a thank you for all of his support for community health centers. And then, of course, Senator Sinema, Senator Kelly, and we expect great things out of you. You've got a great delegation, and so that's kudos to you, again, for what you do and your ability to advocate. Next slide, please. So this is what has happened. I know that some of you know this, but when I talk to the folks in the field, not everybody is aware of all of these numbers. So let's just recap, because again, this is a result of all of your work. $7.6 billion directly to you. 7.6 billion for the public health workforce, 7.5 CDC vaccination program, 47.8 billion to HHS for the implementation of national testing and tracing, and then a number of different funds for various workforce programs. And again, that is all owed, next slide. That is all because of you. You know, I'm fortunate being in DC. I'm just a kid from Grand Rapids, Michigan, and I pinch myself when I think of working. I work for the Kennedy Shriver Organization Special Olympics, and I got to interact with them when they were still alive, and now it's been passed to Tim Shriver. I work with Susan Eisenhower and their family on the Eisenhower Memorial, and I am equally in awe of the power of the health centers. Imagine what you guys do through the care of 30 million patients across the country, and of course in Arizona. I know it's not easy. I know it's hard work. I know that it's sometimes thankless, but I will tell you this: I am in awe, and so are my friends on Capitol Hill. They consistently pop up and prop up when I have to talk about all of the great things that you are doing. You know, last year was tough, and I worked very closely with John McDonald, and I miss him, but Tara was right there along with me, and she was extremely and is extremely effective. But even when COVID hit us and a lot of doors were shut, Tara, you guys were still building. Didn't you just have a ribbon cutting in the fall?
Yeah, we did for NOAA. NOAA did a ribbon cutting. And I'd also like to mention that all of our health centers came together and agreed to participate in Zoom calls with all of our members of Congress. So we didn't miss a beat. And we brought up all of our most important issues, financial stability, infrastructure, telehealth, 340B, and educated their staff and our members of Congress. And not only once, but twice, and sometimes 3 times. And so we made sure that there wasn't a gap at all.
You did great, and all of your colleagues who are participating are to be congratulated. So thank you again. Let's go to the next slide. Okay, so where are we presently? I know that all of you, as busy as you are, you're still turning on the news or reading the newspaper or whatever, Twitter, and you're seeing how chaotic it is. It is, like I said, it's the most fractured I've ever seen in my career. Even the definition of infrastructure is contested. Now, we all know in the good old days that it was about roads, bridges, and highways. Well, we're not living in the good old days anymore. And the term infrastructure should mean different things and more. We've got a crumbling healthcare infrastructure. We've got a crumbling infrastructure, whether it's defense, et cetera. And we need to regroup and rethink and think outside the box. So that's a contested term. With that, the administration did propose a $1.2 trillion traditional infrastructure bill, and the Republicans are pushing back and throwing in a number as high as $800 billion. But right now, what's on the table is only $568 billion. We'll see how that plays out. Again, the administration has called in some of the Republican Democratic leaders to the White House as recently as last week. Those talks continue. So stay tuned on that. Fiscal year 22 appropriations cycle is in full swing. The president did submit a skinny budget with a broad brush approach, kind of delineating the difference between what the defense and foreign relations funding should be relative to the domestic spending and so forth. We expect the bigger, thicker budget imminently. Again, the delay is I would say largely because it's a new administration, but he did not have the ability to do that number crunching as other incoming administrations are afforded between election day and the next year. And then again, something that Tara had touched upon, and I was glad to hear it, but police reform is getting closer. There's just a couple sticking points, And so those of you who are watching some of those talk shows, Sunday talk shows, have seen that leader Clyburn from South Carolina is spearheading for the House Democrats, and he is even willing to relent on a term called qualified immunity. They're getting very close. Leaders are also going to the Department of Justice to find out the parameters within which they are able to work, so stay tuned. Next slide. Hill requests. So right now, a number of different associations have requested through letters their needs. And Colleen Myman, whom I'm expecting a lot of you have heard from in the past. I think she even presented 340B, right, Tara?
Yes, yesterday. Yes.
Just yesterday. So, so those of you who know her, she and I are working on a letter to the Hill. We've just found out that NAC is doing the same. So what we'll do is we'll work with NAC to find out some parallels to make sure that we're all in sync about those various requests. But infrastructure is one. The House Energy and Commerce Committee, that has jurisdiction over health issues and our funding, had provided $10 billion in one of their bill proposals. I believe that NAC will do the same. I've seen some number crunching. I think we're closer to 16.5. It would actually be 17.5, but the previous COVID bill provides $1 billion, so the request should be closer to 16.5. We don't want to get greedy. We want to show a unified front, but I do know that even on Capitol Hill, there will be differences of opinion. For example, I know that, again, House Leader Clyburn and Senator Bernie Sanders will probably have a higher number than, say, some of our other allies on the Republican side, like Roy Blunt from Missouri and so forth. So stay tuned on that. National Health Service Corps, I could go through a number of different programs and numbers that we're doing, that we're crunching, but I will spare you that. You will see those numbers fairly soon, but we can have facilities, but if we don't have the providers, nothing matters, right? So we're working with Dr. Padilla at HRSA, and stay tuned for that. You'll see a letter fairly soon. Making telehealth available and permanent. We are supporting the Connect Health Act. It was just recently introduced on the House and Senate side. Among other things, it provides the Secretary of HHS to waive various restrictions. It removes geographic restrictions for telehealth services permanently. And then, of course, it allows FQHCs and rural health centers to furnish telehealth from distant sites. So stay tuned. Again, 340B, Colleen probably gave you an extensive review, but we are together working on a bill with two members. It's a bipartisan bill to prevent pickpocketing, and it affects every plan, private, Medicare. We're still working on the Medicaid part. So stay tuned on that one too. Next slide. The power of you. You, to me, are rock stars, and I wish I could talk to all of you, and I never hesitate to reach out to me, but Tara and I have been in the trenches together, and I think we did a lot of good during a very troubling time, Tara.
I would concur. Yes.
So what I want to emphasize again, I threw a lot of numbers your way. I hope that was helpful. Feel free to call. You'll see in the next slide that my email address is there. But I want you to know that you're impacting federal law. Every time that you help a patient, every time you engage a lawmaker, whether it's a local, state, or federal official, you're helping us help you help the patient. You are creating law. So I would ask you to remain involved, if you belong to a Lions Club, a Rotary Club, invite your member, tell your story. It is about the grassroots. It's not about the lobbyists. I know that we're key. I get that. That's why there's an industry. But it is, at the end of the day, you. And it is a privilege working for you. I hope that covers everything. I tried to fit in as much as I can without boring you. Who has the first question?
Steve, I like that approach. I'm sorry to interrupt.
No,
I like
please.
that approach that it goes beyond just working with our members of Congress or our members of the legislature. We have to make that appeal to our community as well. And so,
well, I'm sorry, Tara. Keep going. Keep going.
No. I just think that's a good point, that we really need to deliver this message to our communities and build that support, not only from our community boards, from the health centers, but members of the community. And I know in Arizona, sometimes it's difficult for our patients to step up and be advocates. And a lot of it is immigration issues. But I would say that, to get community leaders on board with us has always been very advantageous. And we have a number of health centers who are really good at that. Two that I would point out would probably be Mountain Park and El Rio, that have done a really good job of, building all of those very important partnerships throughout their communities.
Well, thank you for calling them out. And I hope that they get to tell their story with their colleagues at some point. Everything that we do on Capitol Hill is a campaign. And I don't think campaigns are hard. It's just trying to tell a story. It's communicating. And picture this, everybody. When you go home, you're going to open up your mail. You're probably going to get some mailer from a local politician if you have an election. In Alexandria, where I live, there's an upcoming city election. And I'm getting it. There are lawn signs. There are mailers. These are different modes of conveying messages. Now, if you're telling your city council member about how many patients you cared for, or the challenges your patients find, or what you find, then they at some point, because of their official capacity, they talk to their state legislator, and those state legislators talk to their federal officials. This is a campaign. You're hitting from all of these different angles. Again, at the Lions Club meeting, or the Rotary, or walking on the street, or participating in a town hall meeting, you're hitting them from all angles. Again, Arizona has done a great job at this. So thank you for all that you've done. What else?
So Steve, I keep seeing these messages pop up like, well, what about Valleywise, whatever. I think Danelle framed it well. All of our health centers are rock stars. We have had tremendous participation from all of our health centers. And I only pointed to two because I couldn't name all 23 in 2 seconds. But I think everybody has done a fabulous job, and I'm really proud and pleased to work with all of them in this area of advocacy, because they do a tremendous job.
Congratulations, everybody. Anything else? Danelle?
I was just coming on to say that I don't see any questions in the Q&A or the chat, but I would be remiss if I didn't take this time to acknowledge Tara and her 19 years of service to the Alliance and to our health center. So please, if you're on the line and you've worked with Tara, please send in your gratitude and your notes of thank you. Tara, I can't even describe how she didn't know I was going to do this, but I'm just so grateful, and I just had to acknowledge you and your service to Arizonans. So thank you.
Well, it's not difficult. This is a fabulous mission, and it's going to be hard to step away from it, but I won't be stepping away from it entirely. You can't separate yourself from this. It's been an amazing honor to do this and to work with people like Steve and Colleen, and it's, nationwide. When you see the commitment to this, it is a social movement, and it's been really rewarding. Thank you.
I'll fill in the dead space then, because I remember last year was trying for everybody out there. I know, because I took your calls and I could see it. I heard it. I saw the statistics. People were panicked. It was scary. And I remember the first phone call I got from Tara last year. We talked prior, but last year. And She was just delightful and determined. And with all of that panic, all of the pressure, we rolled up our sleeves and we went through each item, and it was just a wonderful experience. So Tara, yeah, it was a pleasure.
Thank you for being there for me, Steve. I really appreciate it. You've been fabulous.
My pleasure. My
We
pleasure.
did receive a question in the Q&A, and please, everyone, please stay on the line. We have a few polls that we need to do at the end to get some data for our HRSA requirements. So please stay on the line. But we do have a question. Can you address the Recovery Care Act and postpartum care?
With respect to postpartum care? No. In fact, if you want to get me that person's telephone number, I will be happy to get back to them. Either give me a cell or an email address.
Okay, the question came in anonymously,
Oh,
but if that individual...
I tell you what, if you could,
Well,
so
maybe we can work on adding that to maybe a summary of it, because I know that we haven't even touched on the mental health pieces of that or whatever, but if there's something that would be helpful to give them a broader view of it.
okay, I can definitely do that. But if that person would like to email me, if you wanted to maybe flip back to that next page, or here, let me just give you my cell. Yeah, there you go. Just text me, and if it's an anonymous thing, I can keep many secrets. I do. Trust me, I live in Washington. But seriously, call me.
And speaking of mental health, we did get another question. Do you foresee any mental health support coming for community health center employees given the past year? And I know there have been several articles about employee well-being.
For the employees of health centers?
Yes.
Okay, I will look into that as well. And if that, I tell you what I'll do is I'll get back to Tara the answers to this. And then if you would like to, or Danelle, it's up to you, however you want to do that. I'm happy to report.
So yeah, let's work on that, because there are provisions within the American Rescue Plan for mental health services. And I don't remember anything that was directly related to staff in a health center, but definitely the COVID definitely took a toll on our staff members in our health centers.
It absolutely did. And I will say that
our health centers in particular.
Yeah, I know that there is a workplace safety bill that is directed to healthcare that was introduced by Congressman Courtney, and it passed pretty safely. It is now going to be in the Senate side, and I expect Tammy Baldwin to introduce it. I think she's looking for a Republican co-sponsor, and it's also addresses the pressures of providers. So let me look through that provision. I want you to know that lawmakers are hearing you. I just cannot give you the specifics, but I will report to Tara on that.
So we just got a comment from Valle del Sol that they actually have a grant to address this. Is that what I read? Is that what I read? Is that correct? It was from Lynn Emmons. Is that right, Lynn?
Yes, she says yes.
Oh, good. Okay. And so they are actually actively engaged in this, and that's pretty exciting. Yeah, to hear that. So, and I think our health centers are kind of a unique organization, or uniquely adapted to doing things like this. So really approaching it from their staff as the whole person, not just as a worker, but all of their needs. Oh, good. Yes, I'll get that information and get it to you, Steve, because I think it's really good that we can highlight these things.
Very good. I agree.
Yeah.
Thank you. And we had a few other comments come in just about not forgetting to center racism, addressing racism in our systems and displacement as social determinants, which I know all of our health centers are working on. Another comment about postpartum care, so we'll follow up on that. And then Lindsay Dietz mentioned the American Medical Association, and our Chief Medical Officer, Dr. Elk, has been working with them and all of our health centers on a provider burnout survey and around wellness. And so we are working on those efforts as well. I do not see
outstanding.
I don't see any other questions. Any closing comments, Tara or Steve, before we move on to our polls and our closing?
Just a heartfelt thank you for Steve and Colleen, and actually many of my NAC colleagues as well, and to our health centers. You people are just the best advocates we could have, and I think just everything you do just really resonates with the communities that you serve, and thank you so much, and your patients. And I too am a health center patient, and I can tell you, I think they're the best place to get care. Thank you.
I have nothing to add. I would just echo what you said, Tara. It is a privilege to work for each and every one of you. I hope to see you soon. I would love to see Arizona, but if you come up for an advocacy day, please let me know. I'd love to stop by wherever you all are. I really have tremendous respect for all of you. Thank you for what you're doing.
Thank you both so much. I really appreciate you, and I know our audience does as well. Vida, if you'll go ahead and launch the first poll. So this poll, because I forgot to do it after the previous session, is for the COVID-19 panel session. It's really quick. Just how satisfied were you with that session? So we will give this 30 seconds or so before moving on to the next one. Okay, Vida, you can go ahead and switch to the next one. So this next poll will be about this session, state legislative wrap-up and federal health center movement.
Uh-oh. Uh-oh.
And we can't even vote, Steve.
That's just such a tease right there, staring at that screen, and I can't vote. The state panel was great.
All right, thank you so much, everyone, for your feedback. We really appreciate it. There will also be an overall conference evaluation that we will send out on Friday after our last session, but we wanted to get these immediate responses as well. So Vida, you can go ahead and close. Tomorrow's agenda, we have telehealth in Arizona Medicaid. Dr. Solik is going to share on that topic from 11 to 11:55. And then from 12:05 to 1, we will have Dr. Nathan Butts talking about health center cyber security defense. Thank you again, everyone. I really appreciate your time today. I hope you enjoyed the first day of our conference, and we look forward to seeing you tomorrow.
Thank you, Danelle, for all your work. Take care. Bye, everybody.